The first step in treating a medical emergency in the workplace is to conduct a primary survey. A primary survey involves observing for dangers to you and the victim, checking the level of consciousness, examining airways for obstruction, checking respiratory response and circulation. We will now examine the first element of a primary survey: personal safety. The first element of a primary survey is checking the level of danger involved in the situation. When undertaking first aid, it's important to keep in mind both your own personal safety and that of the patient. It's important to move swiftly but with extreme caution. Ensure that you don't place yourself into a situation where you become part of the emergency. Take particular care not to come into contact with electrical current. In the case of suffocation as the result of fumes or smoke, you must ensure not to place yourself in danger by remaining in the space where the patient encountered the toxic element. Care is also vital when it comes to moving the victim where a back or neck injury may be present. Always make it clear to the victim and bystanders what you're attempting to undertake. By making loud and clear statements to the victim, you can reassure them and indicate to bystanders that you are trying to deliver first aid. Once the danger has been carefully assessed, you should then proceed to check the consciousness level of the victim. If a victim is unconscious, then continue on to the next phase of the primary survey, checking the airways. If victim is face down, gently roll them onto their back. If back or neck injury is suspected, enlist the aid of others to keep the victim's head, neck and back aligned as you roll them over. Once the victim has been rolled over, then proceed to open their airway using head tilt. Kneel by the victim's side. Place one of your hands on their forehead and gently tilt their head back. Place the fingers of your other hand on the bony part of the victim's chin, not on their throat. Gently lift their chin straight up without closing their mouth. If the airway is clear, then try to gauge the ease of breathing. Look, listen and feel for breathing for 5 to 10 seconds by placing your cheek near the victim's mouth and watching for the chest to rise and fall. Finally, check for signs of circulation, such as movement, groaning or coughing. If the victim is not breathing and has no signs of circulation, commence CPR. Checking the airways, breathing and circulation of a victim are often referred to as the ABCs of emergency